and good afternoon. East Coast time. It is Thursday, August 29, 2024. I'm Dr. Deuk Majin. We're at the Deuk Spine Institute. Our next case is a patient with cervical facet pain, adjacent segment disease to a prior fusion, and laminectomy. He has an ACDF, and the ACDF is at C4-5, C5-6, C6-7. You're going to see that on the x-ray. He has arthritis in the facet joints above his fusion. My goal is to go up and treat the arthritis in those joints. Will not be easy, but we'll do our best. Okay, we're going to get started. If you have questions, feel free to ask them. I'll do my best to answer. Shot? All right. So, Jordan, I'm going to want to see up to C2, which I need a little bit more. Just a tiny bit. Yeah, that's good. I mean, let's see. Shot? Maybe you had it better before. Let's see. We'll try with that. Shot? I'm going to start on the left side. I think that's good. Make an incision. Our patient is sleeping. You can hear him snoring. He comes to us from Texas, the great state of Texas, Houston, Texas. Now, who is the senator of Texas, the Republican running?
Abbott?
No, there's some. I can't remember his name. He's always on Fox News. No. Well, Cruz. Ted Cruz. Did they already have their elections? Does anybody know? Shot?
I will look that up. I don't think so.
Alrighty then. Okay. So, let's see where we are. We got, the screws are at 4, right? Then we got 3, then we got 2. I see 2. Yeah, I see 2. Sorry, folks. We are, that's better. Thank you. We're just trying to get down to the spine. So once again, 4, 3, and there's 2. All this is done through the back of the neck. Shot. And my target is a little bit more lateral than where I am right now. Shot. It's, if you look at the tip of the probe, it's just lateral to where we are, just a little bit to the side of where we are. I really need him asleep. Shot. All right. We just need to be a little bit more lateral. You're doing great, buddy. Yeah. If you have questions, feel free to ask. You can see he's got the metal plate, screws, cage. Those are top screws are in C4. Then you got a disc space, which is the C3-4 disc space. Then you got C3, then C2. He's got a lot of dental work done, obviously. I think he's had a lot of dental work done. Anyway, let me know when you're ready. Huh? Yes? All right. So right now I'm trying to get down to the spot. Shot, come on, Jordan. And that's the most important part of the surgery, is getting to the target. And I'm literally over the target, but I'm not deep enough. I can feel there's still a little bit of muscle there. I need to get all the way down to the target. Shot. That's a little too medial. So I'll know I'm at the target when I feel bone. Jesus Christ. Don't worry, we're going to get you asleep in a moment. Take your time, Dr. B. Yeah, everybody does these days. But you got to be asleep to have sleep apnea. Right? You like that? I thought that was pretty good.
I laughed. That was good.
Dr. B's right, though. He has to be very careful. But that was pretty funny.
We do have 2 questions.
Sure. Shot?
First one coming from Sydney on Facebook.
Yep. Let me know when I can proceed. Yes?
Sydney asks, is arm and hand numbness and pain normal with cervical issues?
Yes, they are. If you have a pinched nerve, it's totally normal to have arm and hand numbness. Shot? All right, I'm literally right over the target. I've just got to get down to the bone. He's not a heavy guy. He's not a heavy guy at all, but he has a deep neck, which is surprising. There it is. I'm on the bone now, which you have to be on the bone, folks. If you're not on the bone, you're not in the right spot.
We have another question.
He's sleeping beautifully. I don't need you to sedate him anymore. I just need just give me a second on the questions. I gotta focus for just a moment here.
Copy that.
He's perfect for me. I just need to make sure I'm right where I need to be. It's impressive how much the muscles contract, you know? All right. Yeah, I'm not going to take questions for now because I'm going to need to focus right now on what I'm doing. Sorry, I'll take them later.
Not a problem.
The issue with this particular patient is that he's had a laminectomy, so it makes my surgery a lot harder to do. And he's not easy for my anesthesiologist as well. He's a very challenging case. Boy, I mean, I feel bone here. Sean? It's a little more medial than I want to be. So the goal here is to get where you need to be, and then you want to destroy the pain nerves. And his muscles are contracting a bit, which is making it a little harder for me than normal. Shot. It's going well, though. Shot. I'm going to start coming down a little bit lower. Almost done with the side shot. Just a little bit further to go. The pain nerves I'm destroying are in a very characteristic position. Almost done here, Dr. B. Shot. Oh yeah. See right where the tip is, guys? On the x-ray?
Yes, we do.
That is exactly where the pain nerve is. Like exactly, right there. And I just felt it. Yeah, he feels it too. All right, just about done. Shot. Yep. I'm literally dancing with my probe right on the junction of the lateral mass and just where it falls off laterally. That's where the shot medial branch of the dorsal ramus is. Just about done. 30 seconds and we'll be done with the left. So far, so good. Sorry I'm not taking any questions. This just requires a tremendous amount of focus.
Understandable, of course.
And I will take your questions later, so type them out. We're literally next to the spinal cord, and I don't want to have any issues here. And he's not making it easy for me because his muscles are tightening, which is fine. But at the same time, yeah, we're done with this side. Yep, num. So let's get an x-ray picture shot. I'm going to go to the other side. Yeah, I can work from this side here. Let me have that. So he's had surgery in the front of his spine and the back of his spine both. I didn't do the surgeries. He had a ACDF 3-level. He had a posterior laminectomy. Basically, he had a very invasive surgeries. They were done in Texas. I don't agree necessarily with what was done, but it's too late because he's already had it done. But he's still in pain. He's got adjacent segment disease above his fusion. And he's in a lot of pain. He can't move his neck. He's got classic facet pain, rotational and extension pain. And so he contacted us to get help, and I did a Zoom with him. And on the Zoom, I recognized his symptoms were coming not from the disc, but from the facet joint, which is the second most common source of neck pain, is the facet joint. Shot. Right. So once again, 4, 3, 2. Just in a really good position on that view. Just need to be a little bit deeper. And to get deeper, I need to go through the fascia. And that's the hard part, getting through the fascia. Fascia is really thick connective tissue. If you've ever had steak, it's that white stuff. Yeah, I'm there. It's the white membrane that sits around the meat. And that stuff's tough. Yeah, almost done, Dr. Beef. Less than 5 minutes. It's just every time I burn, he tightens up his muscles. You see that? He has that spasm, which is normal, but his is very pronounced. He has a very thick neck. I don't know what he did, but maybe he was a boxer or something. Who knows? Shot? I don't. It's not scar tissue. It's muscle. He's got a very thick muscular neck. Shot? Shot. So before I burn, I want to make sure my tip's in the right spot. And that's why I say shot. I'm getting a picture. Because there's a lot of things here we don't want to burn. Obviously. There's just that one nerve we do want to burn. Almost done. Shot. And then I am going to take your questions, folks. I'm not leaving you high and dry.
Not a problem.
It's just very hard because of the prior surgery and the laminectomy defect. It makes the surgery much harder. Shot. 2 minutes. Now he's snoring, and you can hear his snores. Shot. He's got he's not happy with us, but he's still snoring. Shot. All right, just about done. And again, there's a very specific location that I'm burning. It's right where this pain nerve wraps around the spine from the side and the front, comes around, and it goes right to the facet joint and gives pain innervation to the facet joint that's full of arthritis. 15 seconds. This is our last one. I think we're done. We're done. Great. All this is done through a 4mm incision. You guys want to see it?
Yes, we do.
Here it is. 2 4mm incisions.
Oh, I believe the light is in the way.
Can we move that one, please?
Pull it back. Tell me when you can see.
Perfect.
2 4mm incisions. See those?
Yes, we do.
But you can also see the laminectomy, maybe the white line there that he had from before.
Yes.
So a little pressure. All done. I'll come answer your questions. Keep them on. Let's show them how cervical facet joints cause pain and how we treat it.
Copy that.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
I'm here with my patient who traveled from California, Northern California. He had a herniated disc at C5-6. It was a small disc bulge. He was told by the doctors in California that he should just live with the pain, give it time, and eventually he'll need a fusion. Is that right?
That is correct. I was told that within 5 years I would be needing surgery. So basically what they were saying, live with pain for 5 more years and then we'll do something about it. One of the things that I've seen a lot of the videos is testimonials, and I will always say, this doctor sounds too good to be true. And actually it is true. I appreciate you, doctor. I really think that is really nice procedure, and the staff here is really nice. They're always very friendly and kind to get you through the process, because when you get told so many times that that's your new life, it's kind of, you're always thinking, is really the way I want to live? If I'm going to live a lot of years, why wait with pain? You know, you need to do something different. And always, whenever you see videos, you're always a little sketchy and saying, maybe it's not true. Maybe this is not what it is really saying. But today, when I felt with no numbness and no pain on the neck and just going through the process, I really been blessed. I'll be flying to California today. I honestly can't say much. You know, it's a miracle. Whenever I heard the testimonials, they say you're a tool for God. It actually seems like that's the way it is. It's a miracle through you. God works through you, and it's awesome to feel better, you know?
I'm so happy for you and your lovely wife who's here with you. You can see you had a tiny little incision. You had the Deuk laser disc repair for your herniated disc. You can see we were in there with the laser, cleaning out that foramen on the right side where the nerve was being pinched. There were a lot of pieces of herniation in there. And the laser cleaned them all out, and your surgery went perfect, and here you are less than 24 hours later. Feeling good, huh?
Well,
with
yeah.
a smile on your face. That's what I like to see.
You know, it's a smile of happiness. It's a smile of joy, you know, that it is doable. And I think no one should be able to be living with pain. I was so happy to see testimonials when they used to say, well, the one regret I have is not going in earlier and living 18, 20 years with pain. For me, it's been 3 years since July of 2020. It's been miserable because I've been with pain. And I've been told by doctors, let's just take time. I did all kinds of physical therapy, acupuncture, you name it, everything that's out there, and nothing seemed to help. And today, with one day of getting something really that's gonna be for life, it's amazing. It's a smile of joy, you know. If you are going through this trouble, don't hesitate on sending your MRI. When I did it, I sent my MRI for free review, and my answer was, yes, you are a candidate. Here I am today, flying back with literally no pain on my neck and no numbness on my hand, which I miss that. It's awesome.
It's wonderful. Now, what is your native tongue? What is your native language?
It's Spanish.
Are you from Mexico originally?
Guadalajara, Jalisco, Mexico.
Guadalajara.
Yes.
One of my favorite songs. Can you tell them in your native tongue how you feel?
Yeah. Quisiera decirles que si están teniendo problemas con una hernia en su cuerpo, manden su MRI, es gratis y les van a dar un resultado, una verificación si ustedes son candidatos. No vivan con dolor, porque el dolor les va a causar toda la vida y los doctores allá afuera les dicen que no hay solución, pero las soluciones existen, simplemente las tienes que buscar y creer, tener fe que tú vas a estar mejor. Si Dios te mandó a este mundo es para que vivas bien, no para que vivas con dolor. Así que te recomiendo que por favor tomes esto en serio, hagas ese paso de mandar tu MRI gratis y habla ya sea con quien tengas que hablar para que ellos te empiecen a guiar y te digan qué es el siguiente paso que tienes que tomar. Así que una recomendación con Dr. Deuk. Muchas gracias.
Muchas gracias, amigo. And Feliz Navidad.
Feliz Navidad. Gracias.
Safe travels, my friend. Thank you so much for sharing. And good morning, I'm Dr. R. Deuk, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled far to come to Deuk Spine Institute, all the way from Michigan. What brought you from Michigan to Florida?
I was scheduled for fusion to have just my one disc, C5-C6 fused. I'd had disc herniation before in my lower back, had it done. I didn't want to have to go through that again. So I did some research, found you had a good record. Your history is impeccable, so I decided to come down here and have it done.
Well, you didn't have a fusion though. You had something else done.
Yeah, I'm sorry. So instead of fusion, instead of going through and the complications and risk of fusion, lack of mobility, I wanted to have laser. I talked to somebody in Mexico that had laser surgery, and she said it worked great. So I thought I'd pursue that avenue, and that's when I kept Googling and searching and trying to find right place. Some places had bad references. You had impeccable record, so this is why I came here, and I'm glad I did.
Yeah, so you were recommended for fusion by another doctor, and let's talk about that for a moment. They were going to fuse one disc, right? Number 5-6?
Correct.
Now, if you go to your surgery video here, you could see that we made a tiny 1/4 inch, 4mm incision, and we fixed 2 discs, not 1, but 2. And it turned out that the disc that you were not going to have fused was actually the worst one. It was the one that was causing the vast majority of your symptoms. And the reason I'm talking about this is it's a common problem. It comes down to being misdiagnosed. And misdiagnosis happens all the time, all over the world with spine problems. And that's what we're trying to fix, is not having patients get the wrong diagnosis, because the wrong diagnosis will lead to the wrong treatment. Because treatments are always based on diagnosis. So if your diagnosis is C5-6 disc, the treatment will be fusion of the C5-6, but that's wrong because you had 2 discs that were problematic. We fixed both. You could see in that video, we were taking out lots of little chunks of herniation out of your C6-7 disc. Definitely needed to be done. How do you feel today?
I feel great.
Yeah, do you still have the same neck pain you had when you came here?
No, my wife can already tell that my shoulders are relaxed. My neck, I feel great, so very comfortable.
And you had your surgery just 24 hours ago.
Yesterday morning.
Yep, and you can see you have a tiny 4mm incision with a Band-Aid. No metal, no fusion, no narcotic painkillers after surgery. We didn't give you opioids, so that's another plus to the Deuk laser disc repair.
I agree.
Yeah, you don't need to be on powerful painkillers. You're back on your feet already, walking around, not in the hospital.
Yep, great. I'm glad I had a guardian angel looking after me.
You did have a guardian angel, and you're welcome. We enjoy helping people like you have successful spine surgeries. Is there anything else you want to tell your fans out there?
Basically, if you need the surgery, if you're having complications, neck, back, definitely come here. I don't care what it costs you for travel or whatever. You can't, it's worth, I mean, priceless.
I agree with you. It is priceless to get out of pain and have no complications from your surgery and nothing bad that hurts you or harms you or changes your life in a negative way. So congratulations. And when do you guys head back to Michigan?
Saturday.
Saturday. So you're going to spend a few more days here?
Yes, sir.
What are you going to do for the next couple of days?
Well, we plan on hanging out in the sun, but
yeah,
it's not the case right now.
I think, yeah, well, you could do. Oh, yeah, it's just a little overcast right now.
Yeah.
But this would be a good day for you to go check out the Kennedy Space Center. It's about 10 minutes away. They have all the displays and history of NASA, and it's really worth visiting.
I'll do that.
Save the beach for tomorrow.
There you go.
Sunny day.
All right.
All right, congratulations. You're
Thanks,
welcome.
Thanks again.
I'm Dr. Deuk Machen, CEO and founder of Deuk Spine Institute, Deuk Joint Institute. I'm here with our patient from
Louisiana.
That's right. I had to have him say it. It sounds better when he says it. Why did you come all the way to Florida to the Deuk Spine Institute?
Well, about 3 months ago, I was scheduled for a cervical disc fusion in Shreveport, Louisiana. Had done all the pre-op stuff, was scheduled within 2 weeks to do the surgery, got to work and started doing some research. The more I read about what they were going to do with the fusion, people having trouble with it down the road, above and below the fusion.
Alrighty, so Dr. Deuk Machen here. We just finished this Deuk plasma rhizotomy, and this patient had pain in their facet joints. What is a facet joint? Let me see if I can show you. This is the cervical spine. He had a fusion done by another doctor. He had a laminectomy done in the back where they cut the skin, went in and took out bones, but he still had horrible pain above his fusion, and that pain was coming from these joints right here called facet joints. We showed you a nice video of how we treat that. So I went down with my probe and I basically cut the pain nerves to the joints in 3 spots, and that is going to take care of that pain permanently. Our procedure is the only permanent relief available for facet pain besides doing a fusion. You don't want a fusion for facet pain. It'd be overkill. So what questions do we have, Henry?
These first 2 questions come from Ping on Facebook.
Hello, Ping.
First question they ask, hi doc, can bad posture cause herniated discs, and is there a limit on how many times you can get the DLDR if the disc reherniates?
Yeah, so first of all, bad posture never causes herniated disc. You have to have trauma to cause a herniated disc, and the trauma tears the wall in the back of the disc. Then bad posture could make some herniations, but first you have to have trauma. In other words, if you never have trauma to your spine's perfectly fine. Just having bad posture will not cause a herniated disc. And then the second question is, if you reherniate, can you have the laser surgery again?
Yeah. Is there a limit on how many times you can get the DLDR if the disc reherniates?
Yeah, so first of all, Ping, we don't want people reherniating their disc ever. If you give your to 12 months, depends on how quick you heal. If you give yourself 12 months to heal, and your disc heals properly, you will not reherniate again. The strength of that bond at the end of the 12 months is so strong, you would have to have a major accident to reherniate. But we do have people reherniate before the 12 months because they do things they're not supposed to do generally. Sometimes it just happens in sleep. It's unpredictable. Long story short, can they have the DLDR again if they reherniate? Yes, they can. And would I recommend that? Yes, I would. But if you've done it twice and you reherniate a second time, so your third surgery, I would consider at that point doing a fusion instead of another laser surgery. With a fusion, you're never going to reherniate, but you got other problems to worry about. Next question.
Next questions also come from Ping once more on Facebook, asking also when can someone go back to a job that is quite physical, and what kind of exercise can they do in the first year? Can you do a pull-up or a press-up, for example? Thank you again.
Well, Ping, depends on what disc we're fixing, your neck, your thoracic, your lower back. But Generally speaking, if you want to do a pull-up, no problem after 3 months, 3 months after the surgery. And a press-up, I'm not sure what that is, but maybe a push-up. You would want to, you can start doing push-ups safely at 3 months as well. But basically, you can go back to aerobic exercises right away the next day, which is walking. I would recommend waiting 6 weeks for jogging. But as far as lifting weights, you can start right away with very light weights, say 20 pounds, and lift those 20-pound dumbbells. That's not a problem. However, to get back to a normal, really heavy weights, you've got to wait a year. As far as a physical job, as long as your job doesn't require you to lift over 40 pounds, you can go back to work the next day. You can't bend over and pick things up from the ground for the first 3 months. So you got to wait 3 months for bending and lifting things off the ground, like concrete bags or mulch bags. Don't want to be doing that for 3 months.
Next question coming from Essential Advantages on YouTube.
Low essential advantages.
Asking, so if I don't have pain, other than getting the rhizotomy for my facet pain when I turn my head, getting the DLDR, as you suggested, would prevent further degeneration?
Yes, DLDR, if you have a tear and a herniation and you get the DLDR done, you're cleaning the tear, you're allowing your body to heal properly. It stops the inflammation in the back of the disc. It should prevent your disc from degenerating further. As far as why do these treatments, do them if you have pain, if the pain limits your life. So what does that mean? What it means is, look, if I have pain from a herniated disc and I just lay in bed all day every day, I'm not going to have disc pain, am I? I'm not going to have any pain because I'm just laying around in bed. But that's not living life. So what I tell people is go out and do everything you want to do, but if you have pain doing it, you need to get it fixed. That's when we come in handy to help you, okay? But if you're avoiding activities because they make you hurt, then you need surgery. Deuk laser disc repair or Deuk plasma rhizotomy. If you're hurting all the time, you need Deuk laser disc repair or Deuk plasma rhizotomy. But if you never have pain at all, no matter what you do, you don't need surgery, okay? The other thing to consider is not just pain, but also pinched nerves. So you could have weakness in your leg, down your foot, things like that. You got to know about those as well. We look for those as well while we're examining our patient.
Next question coming from Eric on YouTube, asking, we have talked a few times. I realize that you are not within my Humana HMO plan. However, Humana found Armin Deuk-Machen in network. Is he your son? Are you training him to do what you do? I was offered a self-payment option, but my circumstances won't allow for this.
Understood. Armin Deuk-Machen is my brother. He's a neurosurgeon. He's in Tampa. He does not do these surgeries and will never do them. These surgeries require millions, probably 10 nowadays, 20 or 30 million dollars investment to be able to buy the equipment, have a center to do these surgeries. They're not available in any hospital. Hospitals don't have the equipment, they don't have the staff, they don't have the supplies needed. My brother Armin Deuk-Machen is on the other side of Florida. He's a very good neurosurgeon. He does fusions and artificial discs and laminectomy. He does everything conventional, but he doesn't do the endoscopic surgery. So you're welcome to go to him, and you'll probably end up with something other than laser surgery because he doesn't know how to do it, and he doesn't have the ability to do it.
And then lastly, but not least, coming from Ping once more on Facebook, asking, are those, from their follow-up questions, asking, are those limitations the same for cervical?
So Ping, the limitations for a 40-pound lifting restriction for the first year is cervical or lumbar Deuk laser disc repair. It is not for the Deuk plasma rhizotomy for facet pain. There are no restrictions for facet treatments. 0 restrictions. You can go back to normal activities the next day. But yes, they're going to be the same for both cervical and lumbar, except the bending is only for lumbar, not cervical.
And that is it for questions.
Thanks for joining us. If you watched the surgery before this, we did the patient's lumbar Deuk laser disc repair, and then we tried to do the cervical Deuk plasma rhizotomy. He could not tolerate it. The thing about non-general endotracheal anesthesia, which is sedation anesthesia, is that you have about a 2-hour limit. People can't tolerate breathing on their belly for more than 2 hours. After 2 hours of lifting your body weight with every breath, you get tired. I mean, just imagine lifting a weight in the gym for 2 hours. Like, you would probably get about 20 minutes and then you'd be like, oh, I can't do it. So when you're breathing, you're laying on the table, you're getting sedation, you're not fully with it, but your body's trying to breathe on its own. And we need people to breathe on their own. But after about 2 hours, people get tired, especially if you're heavy, you're a big person, a lot of weight, you're lifting a lot of weight every time you breathe. So that surgery we had to cancel. We're rescheduling that for next week on probably Wednesday is what I expect. But the patient's doing great. His back's fixed. We just have to get to his neck. Thanks for joining us. We'll be back next week on Wednesday most likely. And maybe we'll broadcast Wednesday since our new website is being launched tomorrow. Everybody check out www.deukspine.com. We have a brand new website launching tomorrow. We still have some bugs that we're working out on the mobile version, but the PC version should be okay.